Hey, podcast friends. This is Dr. Steve Hewlett with the podcast, Simple Healthy Choices for Weight Loss, where every week we help people who have realized that as their health has been declining over the years, the number of medications they are being prescribed is increasing. We want to help you reverse this health path so you can live the vibrant, pain-free, and hopefully medication-free life you deserve to live. If you'd like even more information on this topic, you can go to Amazon or Audible and pick up my book, Your Plate is Your Fate. And if you think my book helps you on your new health path, please tell your friends and leave a review where you purchased it. Hey, welcome back, podcast friends. Now, this episode is going to be the second of a series of 3. So last week, we talked about what causes diabetes to come on in the first place. This one, we're going to talk about exactly what diabetes is. And the next week, we're going to talk about what you can do to prevent, stop, or reverse type 2 diabetes, as long as you don't have too much organ damage that's already occurred. So the first thing I want to talk about is what is diabetes. First, like I said in the last, and the first part of this episode is going to be kind of recapping on what I did last week. But first, remember, diabetes is not a disease of having too high a blood sugar like everybody is trying to tell you. Diabetes is caused by insulin resistance. It's caused by keeping your insulin levels way too high for way too long. And that's a very, very important thing. As we go through this, you'll see why that's important, because we always focus on glucose, but by doing that, we actually make our diabetes worse. So when you keep your insulin levels too high for too long, you end up with insulin resistance. So what is resistance? Okay, resistance, our whole body, it likes to be homeostatic. It likes everything really the same. It wants the same sodium level, the same potassium level. It wants our pH of our blood to be right about the same thing all the time. It has the same glucose level. I mean, it wants everything to be exactly the same. And so when it's not the same, we have different mechanisms to make it either higher or lower. Our bodies can adjust anything like that. So just like with our body temperature, say our body temperature, you want that around 98.6. If our body temperature starts dropping too low, our body has mechanisms to bring that back up. If our body temperature gets too high, like say we're out in the sun or we're working really hard, our body has ways of bringing that back down. Same thing with pH. It has ways to bring it up, has ways to bring it down, because it wants to keep everything the same. But not just things like that, but there's also things like pleasure. Even our pleasure, our bodies do not want too much pleasure. And this is called, there's a part in your brain called the nucleus accumbens, and that's your pleasure center. And just like you see with people who are addicted to cocaine, or people who are addicted to alcohol, or how most people are, they're addicted to carbohydrates, addicted to sugar. And with all these, what happens, just like with pleasure, if you get too much pleasure, say you're drinking alcohol, and when you very first start drinking alcohol, you feel pretty good. But then when you start drinking more and more alcohol throughout your life, the more alcohol you take in, it takes more and more alcohol to get that same pleasure. Same thing with cocaine. That's why people at first, that little bit of cocaine, they may stimulate them. And no, I don't know this, but just hearing people talk. But the more that they take cocaine or whatever they do with it, it takes more and more to get that same pleasure. And that's because the nucleus accumbens is down-regulating or becoming resistant. And we've also seen this with leptin. And the nucleus accumbens, I talked about in my podcast number 10 on why are we addicted to sugar. But in podcast number 20, I talked about what makes you hungry and not hungry. And if you listen to that, podcast 20, you'll realize that we have a thing in our brains that actually make us feel full and stop eating. And that's the medial hypothalamus. And there's a substance, there's a hormone that our fat cells, when they are full, they release leptin. And leptin goes up to the medial hypothalamus, tells our brain, we're not hungry, stop eating. And that's great. And that's how we can regulate our hunger. However, we also found that if you're extremely obese, so you have lots of fat cells, because that's where leptin comes from, is from your full fat cells. If you have lots of fat cells on, you're producing so much leptin that you actually cause leptin resistance in the medial hypothalamus, or a downregulation of the medial hypothalamus. So that means that used to leptin would stimulate that and make it where you're not hungry. And now that doesn't work anymore because you're producing so much leptin because you have so many fat cells on board that you get leptin resistance or you get this down regulation. And that's why it's a common phrase that you hear around that says, you are not fat because you eat too much. You eat too much because you're fat. And that's what it's talking about. Your fat is because you produce leptin. Leptin gets leptin resistance. And now all of a sudden you wiped out your ability to be able to feel full. Well, the same thing happens with insulin resistance, because what happens, glucose in the blood is what stimulates insulin, period. So when you have high glucose levels all the time, you cause insulin to be released all the time. And when you have constant high insulin levels, your body does not want that. And so it becomes leptin resistance. It makes the cells where they are not sensitive to insulin resistance. So your cells are not sensitive to insulin anymore. And if your cells aren't sensitive to insulin, then when you eat blood glucose, your blood glucose just continues to go higher and higher. And this is when the doctors come in and say you have a high blood glucose and call you diabetic. So, and this doesn't happen. Insulin resistance doesn't happen over like a meal or a day or even months. Insulin resistance occurs over years and even decades. So it takes a long time to get insulin resistance. And I'll talk about that in a little bit. But that's mainly because of the way insulin resistance comes on. And it takes that long to fill fat in all your fat cells before the insulin resistance begins. So what is insulin? And again, this is a recap of last week also. What is insulin? Insulin is an energy storage hormone. Okay, that's what it does. It stores energy. And our bodies have two different things that it uses for energy, two different sources. One is glucose and the other is fat. And since we have two different forms of energy, we also have two different storage forms of energy. Our glucose, the way we store that is we take all the glucose, our liver does, and it takes the glucose and it puts it into this little glucose bricks, puts all these glucose molecules together into a glucose brick, and that stores that as glycogen in the liver. And you only have about 10% of glycogen stores. That's all you have. You don't have very much energy. And then 1% of every skeletal muscle. So that's glycogen. Those are glucose bricks. That is the storage form of your glucose. Then the other form of energy was fat. And obviously fat gets stored in your fat cells, which are your subcutaneous fat cells underneath your skin all over your body. And the reason why you have just a small amount of glucose stores and a large amount of fat stores is because we are supposed to use fat for our everyday energy, all the energy that we use all the time with our brain thinking, heart pumping, lungs breathing, thoughts, replicating cells, everything else like I talked about last time. So we need lots and lots of fat for our energy sources. The glucose is only there. The glycogen is only there for a fight or flight. That's all it was meant to be, is for a fight or flight, something we can get glucose in the blood really quick, get some quick energy, and then let the glucose come back down. So when you need energy, that's exactly what happens. Your fat is always going. That's what you're supposed to have. In the normal, healthy person, your fat is always burning. You're constantly, what you're supposed to be doing is filling your fat cells when you eat and then burn your fat cells out of your fat cells during your everyday activity during every single day. Eat again, fills your fat cells back up, and then stop eating and it burns that back out. That's what you're supposed to be doing all the time. And then in the middle of that, if there's a stressful situation that comes up, whatever that stress is, all of a sudden now you need quick energy. And the problem is glucose is very quick to turn into energy, and fat takes a long time. So what you have to do with fat is you want to keep your glucose levels low, so you keep your insulin levels low, and that way you're burning your fat machine constantly. You're always burning the fat machine. But then all of a sudden you have this fight or flight, some kind of a stress that comes up, and you need to be able to put glucose into the blood very quickly, use that quick energy to take care of whatever the stress is, whatever that is. Then when the stress is gone, your glucose comes back down, so your insulin comes back down. And once your insulin is back down, now you can start burning the fat again out of your fat stores. And that's exactly what you're wanting to do, because when you burn energy, when your body needs energy, it's going to do it first. It's going to take the quickest energy, and the quickest form of energy is going to be whatever energy is in the blood right now. After it gets rid of that energy, then it's going to go to the stored energy. And in every case, glucose is easier to burn than it is fat. It's quicker to burn. So if you're in stress, you're going to use the glucose in the blood first, then the fat that's already in the blood. Then you're going to go to your glycogen stores, your glucose stores. And if you depleted all that, now you're going to go to your fat stores and you're going to start depleting all that. So 2 important things that I really want you to understand. 1, high blood glucose is what stimulates high insulin. High insulin being stimulated too high, too long is what causes insulin resistance. The other thing I want you to realize, remember, and I've said this in several podcasts, including the last one, when your insulin levels are high, it forces you to store fat. You cannot burn your own fat. When your insulin levels are low, it causes you to burn your fat. You can't store it. And I talked all about this in podcast number 35 on what determines whether we store fat or burn it for energy. So if you don't know what I'm talking about, please go back to that. And I explain exactly on the molecular level, but I'm trying to make it easy on exactly why that happens. High insulin makes us store fat. Low insulin makes us burn fat. So what happens is, like I said, when you have your normal energy, you're sitting going, you're going through your normal energy of your fat burning. So you're burning your fat for your energy. You have a stressful situation or your glucose goes high. Actually, anytime your glucose goes high, and there's only 2 things that make your glucose go high. There's only 2 things. Stress, and I talked about that last time. When you're stressed, you produce a stress hormone called cortisol. Cortisol, through a series of steps, causes your liver to break your glycogen stores down and put that glucose into the blood, okay, for quick energy. That's stress. But then after stress is gone, now that glucose comes back down, your insulin levels come back down, and now you go back to your fat burning again. So insulin is what causes you to have your immediate energy. That's what's going to make you, one, it's going to use your stores for the energy that you want. The insulin actually allows your body to use the glucose that's in your body. The insulin also is what forces your body to make glycogen stores. So when you eat a meal, when you have all this excess food on board, excess glucose, your body will actually tell your body to go through and assess your glycogen stores and fill those up first. But after you've had a meal, after you've used all your glucose for whatever immediate energy, for stress, it's going to be that energy. But after you eat, usually people aren't in a stressful situation right after they eat. So after you eat, if you did have a stress, if you did have some kind of activity, the glucose would be there for that. But chances are after you eat, you're not going to be doing anything but sitting around probably. So the first goes the immediate energy needs. Then the insulin forces your body to take the rest of the glucose, fill up your glycogen stores. And when all those are filled up, what insulin does is it forces your body to take all the excess glucose that you didn't use for those 2 things and convert immediately into triglycerides and store that as fat. So that's what insulin does. It causes your body to convert this glucose into fat. Well, once that's converted into fat and the glucose isn't in your blood anymore, your insulin levels go low. And now with low insulin levels, you can take that fat and you can store that in all your fat cells. And then in all situations, if your blood glucose ever gets over like 160 to 180 milligrams per deciliter, our bodies already know that that's too high. We don't want that high of blood glucose. So we start excreting that out through our urine. And all this will make sense when we start talking about the diabetes itself. So that's what happens. High insulin, store fat, low insulin, burn fat. And so in a regular person, this is called metabolic flexibility. That's what you want to be able to do. Metabolic flexibility means that you can go back and forth between using fat for your energy source, then you can go to glucose for your energy source if you need really quick for a fight or flight situation, and then go back to using fat for your energy source again. That's metabolic flexibility. And it all depends on how well your insulin is working as far as what you can do. And I talked all about metabolic flexibility also in podcast number 44 on what is metabolic flexibility and why should you care. So the whole key to all this is trying to keep your insulin levels very, very low. That's what you want to do. If you can keep your insulin levels low, then you can continue burn the fat out of your fat cells. And that's where you keep your weight off. You keep your fat cells empty and you keep all your weight off. So one way you can do this is by doing what's called time-restricted eating, or it's also called time-restricted eating or intermittent fasting. Either one of those, there's a little bit of difference. I'm going to explain the difference in episode 48 on what is the difference between intermittent fasting and time-restricted eating. But basically, all that's saying is you're going to eat all your meals in a 6 to 8 hour time period and don't eat anything for the rest of the time. And again, the reason for this is if you're not putting glucose in your mouth, then you're not putting glucose in your blood. If you're not putting glucose in your blood, you're not putting high insulin levels in your blood. You're keeping your insulin levels low, and you're able to burn your fat from that. And that's the whole key. So that's why we do intermittent fasting. The key to this, when you do intermittent fasting, because everybody talks about how they think you're going to get so hungry, that's not the case. Because if you're keeping your insulin levels low, even after you eat, that means that you're eating healthy. That means that you're eating animal protein or animal fat. Because those two things, fat does not stimulate your insulin levels at all. It doesn't have any effect on your insulin levels. However, protein, if you're eating animal meat, it has a little bit of effect on insulin because remember, 1% of every one of your muscle cells has a glycogen store. So there's a little bit of glucose in that, but not very much. The main thing is going to be with your food, what you eat. Because if you aren't eating good animal protein, good animal fat, and if you want to eat some fruits and vegetables, that even though those are carbs, they're natural carbs or God-made carbs, they still have fiber. You don't eat very much of them because they already come prepackaged. Those are fine. It's the man-made food that is killing us. And I'll talk all about that in the next podcast. But basically, the whole thing is to keep our insulin levels low. And what happens, a lot of people say, well, what if my blood glucose goes too low? What if we get hypoglycemic? And then that's horrible. Under normal circumstances, your blood glucose will not go too low because your body regulates it. As long as we don't screw up our body and we can produce insulin the way we want to, and we're not taking diabetic medications, we can control our insulin and control our blood levels because we're using fat for our energy source. We're not using glucose for our energy source unless we get fight or flight. Since we're using fat, it doesn't stimulate insulin. If it doesn't stimulate insulin, it's not going to make our glucose levels drop. So our glucose levels stay the same. The only time, if it does go low for whatever reason, say you do have a stressful situation, and the stress situation goes on for a long period of time, there are two ways that our bodies can put glucose into our bloodstream. One is called glycogenolysis, which is what happens in a fight or flight. Glycogen, remember that glycogen is the storage form of glucose in our liver, and lysis means to break down. So when we have a stressful situation, we produce cortisol. Cortisol stimulates our liver for glycogenolysis. It stimulates to break down the glycogen into glucose and put the glucose into our bloodstream where we need it for whatever fight or flight energy we're needing at the time. So that's one way that our body puts glucose into the system. The other way is called gluconeogenesis. And gluconeogenesis just means making glucose from a non-carbohydrate source, because all carbohydrates are made out of glucose. All carbohydrates, when they get broken down to the basic building block, was glucose. So proteins get broken down to amino acids, fats get broken down to fatty acids, and carbohydrates get broken down to glucose. Okay. So when you have gluconeogenesis, that means you're not eating the glucose. Your glucose goes low because of a stress situation. So your body is extremely capable of turning fat into glucose, and it's capable of turning protein into glucose. Both of these. So you never, ever, ever, ever have to eat any carbohydrate for any reason. Your body can make all the glucose it needs, because the only glucose it needs is something for a fight or flight situation or to refill the glycogen stores. And it can do that with protein and fat. So you don't need any carbohydrates whatsoever. And that's really important. Now, there is an abnormal way that your body is going to go low on glucose. One of those is going to be if you're starving, actual starvation. Because when you're actually starving, that means you are not eating anything, which means you're not putting glucose into your bloodstream. So your insulin levels are always very low. Since they're always very low, the only energy source, since you're not eating glucose, the only energy source it has is your fat cells. So it's burning all the fat out of your fat cells, and it continues to do this until all your fat stores are totally empty. Then it will also start eating your muscle. This is starvation, and this happens after months of going without food, weeks to months without going with any food. And so that's a very rare system. The other time that you're going to get low is, like I said, if you are eating correctly. Say you are diabetic, but you're wanting to change your ways. So you stop eating carbohydrates like you're supposed to, and you start eating animal protein and animal fat like you're supposed to. So now you're not putting glucose in your system. However, since you've been diabetic, you are still taking diabetic medications. Diabetic medications work by stimulating your pancreas to make more insulin. So if you're already keeping your insulin levels low because you're eating correctly and you're taking diabetic medication, your blood glucose will drop down very, very low. And this is one of the most common adverse effects amongst all the diabetic medications is too low of blood glucose. It's called hypoglycemia. And that's why it's so important that if you are diabetic and you decide to start eating healthy so you can reverse your diabetes, you have to do this with your physician's guidance because they're going to have to monitor your blood sugar and slowly decrease your diabetic medication so you're not stimulating your insulin production anymore. And that's very, very important that you do that. So what happens, like I said, there's two different types of diabetes. Okay, first, type 1 diabetes. This is people who their pancreas just did not produce any insulin whatsoever, doesn't produce it. So obviously their insulin levels are always, always low. These are the patients that before 1922, before we found about insulin, before that was discovered, these are the patients came in, there's just like what I just said, they were so emaciated because they don't produce any insulin. Therefore, their insulin levels are low, non-existent. So they're burning their fat for all their energy needs. So depending on how much fat they had on when they first became a type 1 diabetic, and they don't really know why. They think it's an autoimmune disease, something that happens in childhood that affects the pancreas. And so it makes it where it doesn't work anymore. But no matter what, if you're not producing any insulin, if you can't do anything about glucose, you can't produce any insulin, you're using all your fat stores. These patients came in extremely emaciated and they didn't have a very long life. However, in 1922, when they discovered insulin and they started giving insulin to these patients, they found out that if they gave them carbohydrates and they gave them insulin, all of a sudden they would start fattening up again. They would start getting their energy stores again. So we'd give them carbohydrates, give them insulin, give them carbohydrates, give them insulin. And all of a sudden these patients were fattening back up. They were feeling better again and everything was great. They had a pure life again. However, okay, with type 2 diabetics, remember type 2 diabetics, these are the ones who it's all because of what they eat. It's not that they don't have any insulin. It's because they have way too much insulin. They've had insulin for a long time for high levels because they eat carbohydrates all the time. They've been constantly eating carbohydrates, snacking, eating all this man-made food. And so they end up becoming insulin resistant. And these are the ones who come out and they're very, very obese, okay, because of this reason. Now, just so you know, there's also a third type of diabetes that we see now called double diabetes. That means when you have type 1 and type 2 diabetes. And this is really bad. And the way this happens is you have type 1 diabetes. You can't produce any insulin. However, you can give yourself insulin. So the way we're telling people now, not me, but the way the endocrinologists and diabetic educators are telling people now is go ahead and eat the food that you want. Don't change your diet. Just make sure that you regulate your glucose so you give yourself enough insulin. So these type 1 diabetics that don't produce any insulin found out that now they can eat anything they want to as long as they give themselves enough insulin and it keeps their glucose levels down. But what they're actually doing is they're forcing all that glucose to be stored as fat. So now where type 1 diabetics used to be very emaciated because they didn't have insulin, now we're making them extremely obese. So they have type 1 diabetes, but they're still obese because they can give themselves insulin. So it only makes sense that the most common thing to say is, even if you're type 1 diabetic, if you quit putting glucose in your mouth, the amount of insulin that you're going to have to use is going to be so minuscule and you're going to save a ton of money on doing this. So whether you're type 1 or type 2, you can still do very, very well by not putting glucose in your mouth. So what happens? How do you know if you have diabetes? What happens is that it's called the 3 Ps, the 3 polys of diabetes. And because your glucose is so high, remember one of the ways that your body, like I said, if it gets over 160 to 180 milligrams per deciliter, your body's going to automatically push that glucose out through your urine. So when glucose goes through your urine, it pulls water with it. So diabetics back then, when all they had was a high glucose, what started happening was they started peeing all the time. Well, when you pee all the time, that's called polyuria. Well, since you're peeing all the time, you're thirsty all the time. So you start drinking all the time. And that's called polydipsia. So you're peeing all the time. Now you're drinking all the time, replace it. And since you're insulin resistant, then you have polyphagia. You can't use the glucose for the energy that you want, but your glucose is high and your insulin levels are high because you're insulin resistant. So if your insulin levels are high, then you're not going to be able to burn the fat. So now you can't use the glucose because you're insulin resistant. You can't use your fat because your insulin levels are high. And so you become very hungry. Every time your body needs energy, it makes you hungry. And that's called polyphagia. And those are the three polys: polyuria, polydipsia, and polyphagia are the three. That's a triad of diabetes. Now, what happens with this? When you keep your insulin levels high and you keep your glucose high for extended periods of time, what it does is it starts tearing up all the blood vessels in your body. That's what is the real problem. That's where you get all your high blood pressure. That's where you get your organ damage. Everything is because all this high sugar and high insulin is tearing up your blood vessels. The first ones they tear up are your little bitty blood vessels, your micro vessels. And these are going to be in your eye, they're going to be in your kidneys, and these are in your nerves. So this is where you get tearing up of the blood vessel in your eye is called retinopathy. And this is why you can start becoming blind. Then when you tear up all the blood vessels in your kidneys, you get nephropathy. Your kidneys start failing. And type 2 diabetes is the number one cause of patients going on dialysis because of all the carbohydrates they've eaten and they've torn up their kidneys. And then the last one is called neuropathy because you start tearing up all the nerves, all the blood vessels in the nerve, and now your nerves don't work as well. And this is why you've got to hear this. If you are type 2 diabetic and you are having neuropathy in your feet, you must check your feet every single day. Do some kind of a routine when you're sitting there. Put a little mirror on the floor in front of the toilet stool so you can see the bottom of your feet or whatever. Because one of the biggest reasons why patients end up having amputated legs is because they get cuts on their feet, but because they can't feel them, they have no idea. They're not looking at their feet. A lot of people can't even look at their feet. That's why using a mirror is a good thing, mirror close to the floor. But they get these cuts and they get such horrible infection, but they feel no pain. So they have no idea that they have a cut until they go to the doctor and find out that part of their foot's already been eaten away with an ulcer. And if the infection gets too bad, that's when you have to start amputating legs. So please watch your feet, especially if you know that you have neuropathy in your legs. But after it does a microvascular, now it starts breaking up all the larger blood vessels too. If you don't get your diabetes under control, you start tearing up the bigger blood vessels. This is where you get atherosclerosis. This is where you get heart disease. You get strokes. You get peripheral vascular disease. You get Alzheimer's. You get cancer. You get fatty liver disease. You get infections. You get skin and nail conditions, all kinds of skin conditions. You get erectile dysfunction. And you get polycystic ovarian syndrome, POS. And this is a big reason why patients with diabetes have a hard time getting pregnant also because of this polycystic ovarian syndrome. So this is no little thing. This obviously leads on to death. And that's what we've talked about. So again, there's type 1 diabetes, which means you don't produce any insulin. Type 2 diabetes, which means you produce way too much insulin for way too long. And now, sadly to say, we have double diabetes because we still try to keep telling people the same thing that we told the type 1 diabetics back in 1922 when we came up with insulin. We said we could save their lives by feeding them food and giving them the insulin. That is not the same with type 2 diabetics. You are killing yourselves when you do this. And now the type 1 diabetics are becoming type 2 diabetics because of giving ourselves insulin, because of taking all this medication to try to bring our glucose down. But we should not be worried about the glucose. We need to be worried about the insulin. Actually, you're worried about both. You want to keep your insulin levels down and you want to keep your glucose levels down. And in order to do that, the only way to keep both your glucose and your insulin levels down is quit eating glucose. It's that simple. And also stress. If you're in a stressful life, if you're in a stressful situation and you're stressed all the time, that also is very hard on your body. That also continuously puts glucose in your body and can cause insulin resistance as well. But chances are when you're stressed, you're also eating. A lot of people do stress eating. So if you can stick to animal protein, animal fat, and just a few real fruits, real vegetables, just enough for like condiments on your plate, you will be fine. You'll keep your glucose level low and you'll keep your insulin level low. So what exactly you need to be able to do to be able to actually prevent, stop, and reverse insulin resistance which is called diabetes. That's what we're going to talk about in the next episode. So that's all I've got for now. I hope this made sense to you. And as always, have a fantastic week. And thanks for listening. And remember, make simple, healthy choices to live a quality life. If you enjoyed this podcast, please hit the subscribe button below and be sure to tell someone else who may want to change their health path as well. And don't forget, you can also purchase my book, Your Plate is Your Fate, on Amazon or Audible. And if you do, please leave a review.